Hi, welcome. Dr. Charles Bradley talking to you from Domino Vet. It's Facebook Live here at Domino Vet, and today we're talking about heartworm preventatives and general parasite preventatives. We'll talk a little bit about dog and cat today. It's a very interesting topic, and there's a lot of different opinions, and I'll tell you what we generally use as guidelines, and we can talk about some of the products as well. But the basic notion is we are trying to prevent disease. So heartworm disease is the name brand. Everybody knows that a dog gets heartworm pills. But today, as I look out my window, I see snow. It's well short of 64 degrees, I think, at this time. Maybe it'll hit 64 today, I'm not sure, but that's obviously not normal for January. So the chances of getting heartworm transmission are low. We need 64 degrees for several days, actually. That may or may not exist in micro situations, microclimate situations, but there's more to heartworm pills than just heartworm prevention. So the most popular heartworm pills for dogs right now would be the HeartGuard Plus. I think many of you will notice this. This is a little chewy treat. It's very popular with little dogs because it tastes very, very good. This does heartworm and 2 intestinal parasites. Now, what we recommend in our clinic is Sentinel. This is milbemycin, oxime, and lufenuron. So this is going to do intestinal parasites as well. So these heartworm pills, think of them as internal parasite pills. So this is preventing, these strategies or these products are preventing the parasites that are on the inside of the dog. Now, we also have another class of antiparasitics called flea and tick medications, or flea medications in some cases, and those are a different class. It used to be, this is the new class, this is the new school, and the old school. It used to be that we would use frontline topically on dogs, that means on their skin, to prevent the fleas and ticks, which are the parasites of the outside. Used to use those, but now they've been replaced by orals. So let's just get into the details a little bit, and then we'll talk a bit about cats. So let me talk about HeartGuard Plus first. This is my second favorite. I like HeartGuard Plus because it is a combination of ivermectin to kill heartworm and pyrantyl pamoate. So at this time of the year, we're preventing mostly roundworms and hookworms. So we do this year-round. Every single month of the year, you give something to your dog. I would prefer that you give your dog Sentinel because it's going to do more for your dog. It's going to do 5 things. HeartGuard is 3 things. HeartGuard does heartworm and 2 intestinal parasites. This does heartworm, 3 intestinal parasites, and it also sterilizes flea eggs. So the Sentinel is my favorite. We use that for Frank, our family dog. And this will prevent heartworm, and on the intestinal parasite side, it'll do roundworms, hookworms, and whipworms, and it'll also sterilize flea eggs. So Sentinel is the best, HeartGuard is the next best, and there's other competing products that you can certainly research. I will do a little aside here. There's another product called Revolution. Now, in areas where there are no deer ticks, this is a very popular strategy. When I used to work up in Ontario, which is in the central part of the continent, there are no deer ticks essentially. So we didn't have to worry about ticks, and this is an all-in-one product. Revolution is good for fleas, it prevents heartworm, and it takes care of some of the intestinal worms too. So if you have a dog that doesn't like to eat oral, or if you want easy peasy, or if you have a dog that's never exposed to ticks, there are some situations where we will use Revolution. All right, so let's talk about the orals. It used to be that frontline was the way to do flea and ticks, and the orals, by that I meant that we have now changed to an oral strategy for the external parasites. So now we're talking about fleas and ticks that live on the outside of the dog. So we used to put frontline on the outside of the dog. We don't do that much anymore. We have a little bit of stock left over, but now we have transitioned to an oral strategy. There are different products. There's NexGuard, Brevecto, and Simparica. We happen to use NexGuard in our practice because it's easy to remember. It's a once-a-month strategy, so that's easy peasy. So our general combination would be the Sentinel for intestinal and internal parasites, and the NexGard for external parasites. So what's good about NexGard? Well, one of the things I was very surprised about with NexGard is how easy it is to give. Much easier than parting the hair coat of a dog. And dogs love this, and it's very easy. And so far it's been very safe. There are some fearful stories on the internet, but we have had no reactions to this product at all. Now I just want to finish up talking a little bit about cats. Cats also get parasites, and we would like to maybe talk about them as well. And really we should probably restate this talk as a talk of parasite prevention. So cats get parasites. Probably the go-to product for cats is Revolution. Revolution can do 4 things on the label and 5 things off label. So what it basically is it's an excellent flea and tick, I'll say that again, an excellent flea preventative and off-label tick preventative. It takes about 4 days to kill a tick with Revolution, and that's less of an issue with cats, so we can get away with a single product. This also kills heartworm, a larvae. So if they get bitten by a mosquito that's laden with heartworm, this will prevent that. It also controls intestinal worms, hookworm and roundworm, and it also does ear mites. Now some people say, gee, Dr. Bradley, I'm really worried about ticks on my cat. So I would not suggest this in that context. Rather, we'll go over here to the other one called Frontline. And Frontline Plus for cats is excellent for flea and tick preventative. However, there's no heartworm prevention here, and there's no intestinal parasite prevention. So that's sort of the summary statement. I think the take-home messages would be, for dogs, it's a monthly thing. You do it every single month of the year because you have so many moving parts with dogs, and there's so many different things that they can get. Even with a snowpack on the ground here, as soon as this snow is gone, the ticks will be active and biting dogs, transmitting anaplasmosis, Lyme disease, and ehrlichiosis. So the NexGard is very important. And the heartworm is given year-round because who can time when it's going to be 64 degrees? So we don't like the old 6-month model. I think that that's dangerous. I've had some dogs end up with heartworm in this area because they actually did not have the prevention in place for the 12 months. So every month for a dog, you do 2 things. They're both internal. They're both oral medications for both the internal parasites and the external parasites. And for cats, I think you can probably get away very often April through December with a topical, a single medication for both the fleas, ticks, heartworm prevention, and certain internal parasites. So that's my talk. I'll just check with my producer and see if we have any questions that have come in. Kelsey, anything has come in? No questions today. We do encourage questions, by the way. And if you want to share this message with your friends, we encourage that. Our mission is really to teach. I think veterinary medicine has a large teaching component because there's so much to know. I'm learning all the time. 35 years in, I'm still learning. And I look forward to talking to you again. And this has been Facebook Live from Domino Veterinary Hospital. Dr. Bradley saying, have a great day. Thank you.